नमस्कार, मेरा नाम पार्थ प्रतिम बोरा है। मैं गुवाहाटी असम से बिलोंग करता हूँ। मैं एक सीकेडी पेशेंट हूँ, स्टेज 5 का मैं पेशेंट था। आई वाज डिटेक्टेड माय किडनी डिजीज इन 2021 December. So after moving from pillar to post, I came to Kolkata in 2022 and I consulted Dr. Pratik. He suggested me for a kidney transplant, which I was reluctant because I knew the risks of being operated being obvious, and additionally I had blood pressure, I had diabetes, so I was reluctant, and I was in dialysis since last 1.5 years at that time. But after I met Mr. Dr. Jahangir, and then I was very much pleased to meet him, that he suggested me robotic surgery for the kidney transplant. I asked him about the benefits. He said that it will be less painful and it will be precise, and there would be no risks of other organs being disturbed. So at last I was agreed to go for the robotic transplant. In April 9, 2024, I went for the robotic surgery. At first, definitely, I had some problem, but within a span of 12 days, I was fit and I was walking on my gait, and my all the vitals has come to normalcy. So the entire team and the entire hospital was very pleased at looking at my recovery, and that's it. Now I'm fine. I'm doing good. I don't have any problem as of now. And I'm very much thankful to this hospital and the team of doctors, especially to Mr. Pratik and Jahangir. They had given me ample courage to go for this operation, and I would suggest for everybody to go for robotic surgery, as this is very much less painful and less risky. That's it.
This patient has come to us after being refused open renal transplantation, particularly because of his obesity. The reason of refusal was the fact that it was very difficult in terms of doing an open renal transplantation in such a kind of an obese patient coupled with CKD. After being refused for open transplantation, he came to us with only hope, and we gave this hope a beam of light by giving him the choice of robotic renal transplantation. The patient has done wonderfully well. He has been discharged successfully, and he has come to us in the outdoor with a very wonderful wound response. There is complete healing of wound. There is no wound infection, no wound discharge. He's practically up and about. The good thing about robotic transplantation in him was that he was up and about in the second day, and by the 5th or 6th POD, he was completely almost normal. He did not feel like he had any surgery. The reason being that we generally put the incision as a phalansteal incision, and which is completely masked, and given his obesity, he was not able to identify that suture mark as well. So the good thing about robotic transplantation in these patients is the fact that we are offering them those facilities which the open surgery is being refused from those patients, particularly with respect to post-operative outcome.